This is National Native News. I'm Antonia Gonzalez. The federal government shutdown is in its second week. Tribal leaders across the country are continuing to raise concerns, saying Indian country will bear the burden. Matt Laszlo has more from Washington.
No one knows the full extent of how the shutdown will hit Indian country, but policymakers are braced for pain to come. Democrats continue to band together, demanding Congress intervene to keep Affordable Care Act premiums from doubling in the coming months. Arizona Democratic Senator Ruben Gallega says those future rate hikes promise more pain than today's temporary furloughs.
Well, it just depends. Like, some government workers obviously will feel it when they don't get their next paycheck because they already got the first paycheck. But when people are really going to feel it is around November 1st when they start getting open enrollment, and 24 million of them are going to have their insurance rates doubled.
Take the Indian Health Service. While Medicare and Medicaid are first payers, IHS is a payer of last resort, which means the IHS budget is insulated for now, according to Oklahoma Republican Senator Mark Wayne Mullen, an enrolled member of the Cherokee Nation.
Right now, nobody's affected yet. They're dealing off reimbursements, and a lot of their reimbursements come off Medicaid and Medicare, and of course that's not affected by this.
Even though Mullen isn't worried about IHS cuts, he says that doesn't mean Congress can shrug off the unseen impacts of a federal government shutdown.
There is no pressure taken off of us. We're in a shutdown. The thing is like when are level heads going to prevail in the Democrat Party? That's what we're waiting on.
Indian country was already reeling from federal cuts before the shutdown. Health and Human Services Secretary Robert F. Kennedy Jr. rescinded IHS staffing cuts earlier this year. But New Mexico Democratic Senator Ben Ray Lujan says cuts to other parts of the federal health care budget have been felt across Indian country.
There's a hospital in the state of New Mexico that an IHS facility that no longer offers support for moms delivering kids or having babies. And that's all because of the Trump administration and a direct result of the poor leadership coming from Robert Kennedy.
For National Native News, Matt Laszlo in Washington.
A new law clarifies the role of Washington state's tribes on local boards of health, granting each tribe a seat on their county's board, appointing their own representative. Isabel Charlet reports.
The change clarifies a 2020 state law that requires local boards of health to include members who are not elected officials, including tribal representatives. Vicki Lowe is with the American Indian Health Commission, a nonprofit that works with the state to promote wellness in Washington's Native communities. She says the previous language was not clear about who was responsible for appointing tribal representatives to health boards or how many seats were available.
I'm hoping going forward we can get more tribes on these local boards of health, and the local relationship and working together to keep all of our community healthy and safe will happen.
Every county in the state has a local board of health that is tasked with enforcing health laws, controlling infectious diseases, and setting local policies. Of Washington's 29 federally recognized tribes, Lowe says so far about 15 have appointed someone to their local board. Ashley Bell is the tribal liaison for the Washington State Board of Health. She says the new law respects and affirms tribal sovereignty and makes sure that tribes are a part of public health conversations.
They are a part of the community and really have a direct impact on how community health happens.
The Washington Board of Health is in the first stages of the rulemaking process for the new law, which includes getting public feedback and consulting with the state's tribes and urban Indian health organizations. Bell says they are hoping to be done next July. I'm Isabel Charlet.
And I'm Antonia Gonzalez.
National Native News is produced by Kawanak Broadcast Corporation with funding by the Corporation for Public Broadcasting.
Support by Sonosky Chambers Law, championing tribal sovereignty and Native American rights since 1976. From opioids litigation to treaty rights to tribal self-governance. With offices in Washington, D.C., New Mexico, California, and Alaska. Sonosky Chambers Law.
Skugtash. For more than 40 years, Ramona Farms has revived ancient traditional foods. Tepary beans, pinoli, polentas, and more, all from store.ramonafarms.com. Ramona Farms supports this show. Tom Yang.
Native Voice One, the Native American Radio Network.